Hello, I'm Fun, and I'll be making this presentation on behalf of Health Avengers made up of Ojecha, Rosquin, Abdul Razak, Mustafa, and I. Now to our problem statement. Poor access to quality and affordable healthcare remains a persistent challenge, particularly for low-income and rural populations in Nigeria. Now, our user personnel, we have Aminu Ahmed, 23 years old, recently sent to Borno State for his NYSC. Aminu is asthmatic. He's allergic to certain medications, but because he's in a strange place far away from his hometown, he does not have access to his medical records, and neither do his healthcare providers. We have a data that tells us that according to the WHO recommendation, we should have a doctor-patient ratio of 1 is to 600. But in Nigeria, our doctor patient ratio is 1 is to 4,304 patients. We also have a data chart that shows us the relationship between poor access to healthcare and maternal mortality. This chart proves to us that poor access to skilled healthcare impacts negatively on the standard of living and maternal mortality. We also have this pie chart that shows us the relationship between access to healthcare and income earning levels among Nigerians. Now, what is our solution? To create a mobile app which offers a promising solution by enabling remote consultations, health education, e-diagnosis, laboratory test schedules, e-prescriptions, and medical record management. Now, the focus of our app is on medical record management because this has proven to be a challenge in the health sector. Our idea is to build a unique system where each patient has an ID that provides a record of your previous and recent medical history, something like the BVN, but in this case, the MVN, which is the medical verification number, so that in the event of a change in location, healthcare and access to patient information can be continued. This is what our wireframe looks like. We have the login page, the sign up page, now the page where you register your MVN. We have on that same page, you can book to speak with a consultant, or you also have access to the emergency feature. This page, your test results. When you go to a hospital and you run a test, your results will be uploaded on this platform for you so that you can have access to it in case there is a change in physician or there is a change in pharmacy for you. Now, during our interviews, we're able to pick up three main user pain points. Our user is often frustrated because of inability to access previous health data, especially when there is a change in geographical location. Our user also thinks that waiting time for prescription refills or follow-up takes too long, and this could be shortened if physician already has information on the patient. Now, our user funding, we would carry out competitive study, research, and analysis on existing players in the market. We will also bring on board healthcare professionals, software developers, on other required tech teams for further guidance. We will back which our action points would be to propose a two-step user authentication to access the app, a USSD code to register and call in case of emergency. Why this solution? This software will enable healthcare providers to electronically keep records of patients and easily make it accessible by other healthcare providers. So, what is our aim? Our aim as healthcare avengers is to make sure that quality healthcare is not only a privilege, but it is a right for all Nigerians and for all Africans. Thank you very much.